Inyo County's public health officer, Dr. James Richardson, has received two notifications over the past 3 days from Northern Inyo Hospital District that they had received a positive COVID-19 test for Inyo County residents. The first patient showed up at the healthcare district's rural healthcare clinic with symptoms associated with COVID-19 and was tested based on symptoms and other risk factors. Little is known about the second patient other than that they showed up at the rural healthcare clinic with symptoms associated with COVID-19 and was tested for COVID-19 based again on symptoms and other risk factors. Inyo County Public Health is conducting a thorough investigation to identify potential exposures and notify contacts. At this time, the first patient is currently isolated at home. As of Wednesday, March 25th, NIHD currently has 29 COVID-19 tests pending, while Toyabe Indian Healthcare Project has 2 tests pending. Due to the volume of tests being analyzed currently in California, the turnaround time can take several days. Dr. Richardson says, at this time, it is essential that proactive preventive measures remain a priority to everyone in order to reduce potential exposure risk. He went on to say, Inyo County residents have a responsibility to themselves, their families, and others to remain home and only leave for essential purposes. On March 20th, in an effort to limit the spread of COVID-19, Governor Gavin Newsom ordered California residents to stay home. Later on that same day, a county public health order was released prohibiting non-essential public gatherings, closure and limitations of certain businesses, and required social distancing measures. Public health officials want to remind the public that we must continue to practice appropriate preventative measures such as avoiding contact with sick individuals, wash hands often with soap and water for at least 20 seconds, practice social distancing, and follow state and county orders. If you are experiencing symptoms of COVID-19, such as fever, coughing, or shortness of breath, and think you may have had contact with a person with COVID-19, call your healthcare provider before seeking medical care so that appropriate precautions can be taken. The County of Inyo, Northern Inyo Hospital, and Unified Command Partners are committed to keeping Inyo County residents up to date with the most accurate information. You are encouraged to visit the website at inyocounty.us COVID-19 for the most recent press releases and community updates. There's a third and fourth positive COVID-19 cases in Mono County, and more, as we've said, are expected. A positive COVID-19 test result was received late March 24th from a Mammoth area resident who is critically ill in a Reno hospital. Mammoth Hospital transferred this patient a few days ago. The patient, who cannot be interviewed because of their condition, has no known links to other cases. Others were potentially exposed to the patient in different settings, and the health department has contacted and evaluated as many of these as possible, recommending a 14-day self-quarantine and monitoring. Subsequently, Mammoth Hospital received results from a fourth case, also a Mammoth area resident. This patient was mildly ill and was only tested on March 21st because of a potential workplace contact with their first case. This individual has been self-isolating with a significant other who also recently had a mild illness. The hospital transferred another suspected patient to Reno the evening of March 24th, and this patient is reportedly gravely ill. Yet another suspected patient is hospitalized locally in stable condition. In these suspect cases, tests have been submitted and are pending. At this time, the Mammoth Hospital has two critically ill Mono County residents, one with confirmed, the other with suspected COVID-19 infection. The accelerating numbers of recognized and suspected infections demonstrate more clearly than ever that we have an epidemic in the Mammoth area. Viewers should remember that for every case that is diagnosed locally, there are probably 10 to 20 others in the area. That is especially true with the inadequate testing situation in the United States. The Mammoth Lakes Hospital and Mono County Health Department implore the community to continue to double down, practicing distancing, or as some are now calling it, physical distancing. Mono County Health Officer Dr. Tom Boo said, "This is an extremely serious situation, and we fervently hope that all our efforts to promote distancing, from simple recommendations to the California stay-at-home order to restrictions on hotels, motels, vacation rentals by owners, and campgrounds, will reduce the impact on our community, especially elderly and medically vulnerable adults who have higher rates of severe disease. If physical or social distancing does not work, and if we continue to see accelerating COVID-19 numbers in coming weeks, we anticipate potentially serious impacts on Mammoth Hospital, which has been working intensively for weeks to prepare for just such a possibility." On Tuesday, March 24th, in response to local reports of sick workers present in essential businesses serving the public, Dr. Tom Boo issued a public health order prohibiting the presence of persons with illness in workplaces with possible penalties, including fines, forced closure of workplaces with quarantine orders for coworkers, and even imprisonment. It is an effort to reinforce our message to stay home when you are sick, he said. He went on to say that reports from the public about sick people in public-facing jobs or from concerned co-workers will be investigated. The pandemic is here, representing an immediate threat to our community, especially vulnerable people, and our hospital's ability to keep up with increased demand for medical care. Together with the United Command Team, which includes Mono County, the town of Mammoth Lakes, and Mammoth Hospital, we are urgently trying to avoid replicating in California the terrible scenes from Italy and Wuhan City of hospitals unable to provide care to those who need it, and many deaths. Every one of us has a responsibility to reduce the spread of this virus. Please comply with California's stay-at-home order except for essential activities. And be reminded that the number of positive tests in Mono County, as in the rest of the country, poorly reflects the extent of the virus spread because of overwhelmed laboratories. For the time being, testing will be largely limited to people requiring hospitalization. Please refer to the resources such as Call 911, available in English and Spanish, and or visit monohealth.com's website for more information. We'll be right back.